Hi, good afternoon, everyone. How are all of you doing? I'm Sakina, and today I will have, we are on Dr. School Live, Salmi Asia Facebook, and the topic for today is cervical cancer. Okay, it's very important because cervical cancer is also one of the main killers among women these days. It's a very common type of cancer, apart from breast cancer and all that. So we have with us Dr. Salmi Daraup from Columbia Asia Hospital, Iskandar Puteri, and she is the gynecologist and obstetrician there at the hospital. So, apa khabar doktor?
Baik, Alhamdulillah. Thank you very much, Puan Sakinah.
That's very good. Okay, so today we'll be talking about the risk factors, and then of course we will also be touching about certain things like the basics of cervical cancer. What exactly is it? What are the symptoms? What are the causes? And then at the end of it, doctor has something to announce about a new vaccine which is only available dekat Columbia Asia Hospital Iskandar Puteri. Correct kan, doctor kan?
Ya, betul.
Yeah, so we would like to know more about what this vaccination is all about lah. Okay, so let's start our talk for today. Cervical cancer. Maybe doctor can describe exactly what is cervical cancer. Silakan doktor.
Okay, so Alhamdulillah. So good afternoon, everyone. So today I'm trying to explain and give a little bit knowledge about the cervical cancer. So as we know that the cervical cancer is the second common female cancer in Malaysia. It is stated that according to the study that it is about 2 women dying every day because of the cervical cancer. So at least we can say that the cervical cancer is one of the important gynecological cancer in Malaysia that we know a little bit about the knowledge about it. Okay. Cervical cancer is a disease which is cells in the cervix growth of the control. Means that the normal cells that we have in the cervical, which is squamous and columnar cell, which is in the pathologically, the cells become, the growth is become overgrowth and abnormals. So what does it cause by? Usually it caused by the long-term infection as a result of the HPV, human papillomavirus. So basically cervical cancer is caused by the sexually transmitted disease, which is certain types of the HPV lah. Okay.
So definitely it is something that happens among women who have come of age lah.
Yes.
So it is only through sexual relations? Is that the only way that it is infected?
Mostly is because of the sexual interaction, and 90% of the cervical cancer is caused by the HPV. So at least we must know what is the HPV is about lah. HPV is the common viral infection in the reproductive tract. It can be transmitted from one person to another through skin to skin, genital contact. Means that kalau kita, let's say we are mouth to mouth, there's certain types of the HPV. Okay, there are few types, but usually it's because of the genital contact lah. Okay, genital contact. So it's one of out of 2 sexually adult will have been affected once in their lifetime. So whether we are infected or not of the HPV, there is a risk for us to being infected because it's through the sexual contact. But not of us will manifest the effect. Okay, so that's why we know what are the risk factor for the patients. To know why the patient are exposed to have the HPV infection. Okay, first mostly is multiple sexual partner. Okay, a patient will have multiple sexual partner. Okay, will have exposed high risk to develop the HPV. Okay. Number 2 is early sexual contact. Okay, early age of the sexual intercourse. Okay. Number 3 is smoking. Okay, habit, smoking habit. Okay, so you can expose to have a risk to have the HPV infection, as well as what we call multiple sexual partner. Multiple sexual partner, and the 4th one offers immunosuppressant. Usually we have the kind of the HPV infection, but sometimes we not manifest it unless we are in the immunocompressive. That means we are at the time of we are in the immunosuppressed condition. Okay, such as patient with HIV infection as well. So patient with cancer and everything, other predisposed cancer, they are prone to get HPV infection at the same time.
Yang doktor immune tadi tu that means the immunity system is at a low lah.
Yes, immunity at the low level.
I see.
But the most
So even
important
if
thing
you
is
don't have sexual, even if you're not having sexual relations, but your immunity system is down,
yes,
ataupun you smoke a lot, will that put you at risk as well?
yes, of course. That's one of the risks as well. But the main is, of course, the sexual contact. The sexual contact is the main kind of the infections.
All right.
Okay. So,
But sorry, in terms of macam you were saying that skin on skin, but skin on skin is not just a matter of any skin lah, not just any part of the body, but it has to be genitals, macam Doctor mentioned earlier.
It's much. It's like sexual anal as well. Okay, anal contact. Okay. That kind of things. Okay.
Okay, all right. Another thing, doctor, maybe some people are not aware where exactly the cervix is. Okay, if you can just describe the location of the cervix in the body. It's usually as abdomen, but because there's also the ovaries and whatnot. So cervix, what is it for? There you go.
Okay,
Okay,
so there we go. Okay, there's
Yeah, there we
this
go.
is for the examples of the what we call the uterus and also the pelvic anatomy lah. Okay.
Okay.
So as you can see that this is the fundus of the cervix. Okay. So fundus of the uterus. Okay. As you can see, this is the bilateral middle fallopian tubes, and this is the ovaries. Okay. So the cervix is located at the lower down here.
Okay.
Okay, as the lower down here. So usually what we do when we want to detect any problems with the cervix, usually we will detect by doing swab ataupun pap smear at this area.
But it's only the lower part of the womb.
Yes. Yeah, lower part of the womb. It's like macam the pintu lah. Okay, the opening.
I see.
Opening of the womb. So because the infection here, usually it can be a standard infection towards the uterus as well. So that's the important for us to detect any infection in the cervix.
So for those who have removed their uterus, that means they don't have cervix.
Yes, correct. But you must know what there are two types of the removal of the uterus, whether it is partial or complete.
Oh, I see.
Yeah, if it is complete total abdominal hysterectomy, means removal total of the uterus, the cervix must be included. The cervix must be included.
There's zero risk lah. Tak ada cervix.
Yes, but we still have to swap the vault. After we remove the cervix, there's the vault here.
Why do you need to swap that if tak ada cervix, does that not mean that there's no chance of cervical cancer?
Yes, correct. But there is still what we call the vault, the stump, what we call. The stump that usually we will follow up this kind of the patient at least. Depends on what the pathology of the uterus. Let's say if it is because of the removal of the uterus because of the cervical cancer, then we need to swap the vault. To monitor if there any kind of the recurrence of the disease due to the cervical cancer.
It can happen as well.
Yes, of course. Yes. But if the patient remove this uterus because of the fibroid or something else, you don't need to do so.
Right. Okay. I see. Okay, so not in every case lah.
Yeah, not in every case.
All right. What is HPV?
Okay. As I mentioned before, HPV is quite 90% of the cervical cancer is caused by the HPV infection. It has many subtypes, but the commonest, of course, that we have is the high risk one. The high risk one that we commonly caused cervical cancer is 16, 11, 16, and 18. That is the commonest one. Okay, the fourth one is the commonest one. But now what we have, since we have our vaccine is the already 9 Gardasil 9, okay, which is produced by the MSD, they come up with another 5 subtypes of the cervical of the HPV virus.
Maybe there are a few types of HPV.
Yes, there are a few types actually. There's a few types, but the one that I mentioned before is the commonest cause of the cervical cancer. The other rest, Sorry?
This new vaccine that you were mentioning, it addresses the HPV that causes cervical cancer?
Yes, we have few actually the what we call the development of the vaccine so far. The initially
Yeah.
one is what we call is the bivalent. Bivalent means only two. It only covers two HPV. Then we remove to the four valence, the fourth
Yeah.
that I mentioned just now. The latest one
Yeah.
was Gardasil, which cover
Mm.
nine HPV subtypes, which is 6, 11,
I
16,
see.
18. 31, 33, 45, 52, and 58.
Oh,
That
banyak ni
kind of the
HPV.
coverage, yes, that's kind of the coverage of the vaccine that can be
I
offered.
see.
Mm.
Okay, doctor, I just want to ask, I think from a long time ago, this vaccination for cervical has been around lah. I remember maybe from 30 years ago, ada tak, the girls in school, they are all required to do a mandatory vaccination for cervical cancer,
Yes,
right?
at the age of the 13.
Yeah. So what's the difference
At
between that vaccine and the vaccine that we have now in terms of development?
okay. I believe that the what is the government offer is the bivalent one.
What is that?
That means the only cover 16 and 18 subtypes of the HPV.
Which is not
That one
enough?
is yes, this is not enough because that one is the only two virus. It only cover two virus, okay, which is 16 and 18, which are the commonest cause of the cervical cancer. But that I mentioned just now, the latest one is the Gardasil 9. That's why the name is the Gardasil 9 because it covers other 7 high risk type of the HPV. Other than other than it cause cervical cancer, you also can cover the vulva CA, anogenital CA. That's
Other
why for
disease.
now, yes, other disease. That's why for now we not only promote the vaccine to the female, we also
Yeah.
promote to the male as well.
Oh, the same vaccine.
Yes, the same vaccine. The same vaccine that we have is the Gardasil 9. We also promote to the male, okay, at the age of the 9 to 14, whereby at this age, usually they are not in a sexual contact yet.
Yeah.
Yeah, so at the age of the 9 to 14, other than
Yeah.
female, we also promote to the male. Because as we know that this disease is sexually contact.
Right.
So if we just cover for the female, but we not cover for the male, that means
Oh, I
they
see.
will be
Understand.
infected at the same time. So
Yeah. Right.
that's why for now we try to promote because Malaysian is very, I think it is not the trend yet to vaccine the male. Okay, so we even try to
Yeah. It's always
promote
the
to the
women
female
in the
first.
vaccine.
So for now we have to give a what we campaign lah at least, okay, to give the
Yeah. To
kesedaran,
lessen the risk, both parties
yes.
must do their
Yes,
part.
both party must be protected. So for the age of the 9 to 14, that is the recommended age for the vaccination for male and female actually. So but for at the age of the 9, 14, if we vaccinate them at this age, you only need 2 doses only, which
Okay.
is 6 months apart. If it is more than this age, 9 to 14, you need 3 doses for the Gardasil 9 because the third one is the booster. The first, okay, let's say the first one is after you inject the first one, the latest that we can inject for the second one is about 2 months later.
Okay. And
Then
if you are
to
over
inject
14 years old, you need a third
three
dose.
jabs. 3 jabs.
3 jabs. But then you can be at any age after 14 to what if you like 20, 30 ataupun there's also a limit to that. Oh really?
It's actually
Wow.
yes.
I see.
So that is what we trying as a obstetrician and gynaecologist try to promote lah. Not so to promote lah. I mean, I did to develop the awareness among the parents, okay, to
Okay.
protect
I see. Okay, let me just clarify something here. You mean the age-old vaccine that we used to get when we were school children, long time ago. So even if you have had yourself vaccinated against cervical cancer with that particular vaccine, there are still chances that we can get cervical cancer.
Yes. Why? Because there is a different coverage of the HPV.
I see.
There's a different. The one that we have.
but it doesn't make you free from cervical cancer at all. Lah.
Yeah,
That's
definitely.
it's not very reassuring.
Because you never know
Okay.
what kind of HPV you will get.
Yes. Oh, I see. But yang doktor kata tu, is the common, two of the most
Yeah,
common
that's the
HPV.
common. Yes,
But there
that's
are
the
other
common.
HPV as well that can cause cervical cancer.
Yes, correct.
Okay. Does that mean this new remedy that you have now ataupun this new vaccination ni, does this cover all HPVs that can cause cervical cancer ataupun still there are more out there that's not been addressed yet?
Basically, I can say that it cover almost of the common genital cancer. Other than cervical cancer, it
Oh,
also
I see.
cover for the vulva, for the anogenital, for
Ovaries
the no, not for the ovarian. Ovarian, so far we don't have any what we call vaccine. Even there is no there is a screening for that, but it's not routinely we done. But for ovarian, there is no vaccine for that. That's why I said the only cancer that we can prevent, the earliest detection is cervical cancer. But it's through the screening plus the vaccination as well.
Okay. I'm sure there are also symptoms of cervical cancer that we can detect, or we need to be vigilant so that we can tell that something is wrong. Maybe you can explain to us about the symptoms of cervical cancer?
Okay. Usually, patient will come with the cervical cancer. Usually, they will come earlier. Why? Because they have symptoms. It's compared to the other the other cancers such as ovarian. Usually, they are asymptomatic. If we detect them, if they come to the hospital, they're already in the advanced stage because they don't have kind of the symptoms earlier. If they come with a distended abdomen, that means it's already advanced age. But different from the cervical cancer because the symptoms mainly is bleeding. Mainly because unusual vaginal discharge or bleeding or postcoital bleeding. That means after you have a sexual contact, you have bleeding right after the sexual contact. So most of us as a woman, we will concern about that, because why there is a bleeding after we have a sexual contact. So with this kind of symptom, they will come to the hospital. So that's why early detection can be done. So
how do you know that that's not period?
Sorry?
How do you know that's not menstrual blood? Because you're saying that one of the symptoms is that will start bleeding, but how do women know that there's a difference between menstrual blood and also a symptom of cervical cancer?
If the woman had a regular menses, they will have a specific time for the menses to come. Okay, let's say for last month is the 1st of the January. So they will expect that the bleeding will be on 1st of the February.
Okay.
So they don't expect any bleeding in the middle of the, in the middle of the
timing lah.
Yes, the timing.
Right.
Or there's another one is the postcoital. Means that every time you have a sexual contact, they will have what we call bleeding, which is unusual. Yes.
Okay.
So other than that, abnormal discharge. As a woman, we have our own discharge as well because, but usually it is odorless. Odorless, colorless as well. Okay, but if there is an unusual foul smelly, then it times for us to to contact or to see the doctor. That kind of the symptoms that we need to aware. Okay.
So does this make it easier for a layman to just
okay.
So you know what I mean? Sorry. Okay. That again. Does it make it easier for someone to know that there is a possibility that she has cervical cancer because of these symptoms? I mean, how obvious are these symptoms? Apart from bleeding, are there any other signs that you might have cervical cancer?
What we do other than the symptoms that the patient will presented with, that's the importance of the screening. You know that the pap smear,
Right.
If they did, usually we advise the woman after they have sexual contact or we call sexually active. Once you are sexually active, you need to be screened at least once for the pap smear. Usually in
Once
Malaysia,
a year?
no, once a year. That means if this year you already buat sekali, so you need to do another next year. So if it is 2 consecutive years normal, then you can do 3 yearly until at the age of the 65. Why 65 actually? Because this cervical cancer, previously this disease is common in the old age. Okay, until the 60 and 65. But nowadays, because of the trend now, trend is different. It's more common in the what we call reproductive age. Why? I think because of the early sexual contact, early sexual activity, multiple sexual partner and everything. So that is the cause the disease is become more common in the reproductive age. Not just like the previous one, 60, 55, 65-year-old. So like the previous slide, I think the next slide will explain actually how the actually cervical cancer developed. As I mentioned that 90% of the cervical cancer caused by the HPV infection, but not all the HPV infection. As you can see, there is a trend it's about 10 to 20 years, the development from the CIN1, 2 and 3. Okay, let me explain about the CIN1. CIN1 is the cervical intraepithelial neoplasia. Means that it's a pre-cancer condition. Pre-cancerous condition before we develop cervical cancer.
All right.
So means that for the woman to develop exactly to become a cervical cancer, it's actually maybe 10 or 20 years ago, she already had the infection of the HPV. So that's why the importance of the screening.
At this stage, do you have, are there any symptoms, external symptoms that you can tell atau not yet?
Yes, of course. Yes.
Oh,
yes,
even at this stage? Okay.
At this stage. But usually if they already state, that means the infection already there. So it defeats the purpose of the screening, you know. That's why we encourage people to screen first. To screen because we want to detect at least there is no changes of the CIN1, 2 or 3. Or at least if we detect at the level of the CIN1, it's still treatable. I mean, it's a precancerous one. No need it's not a cancer yet. That means what we can give is we can screen, we can monitor 3 to 6 months later to repeat the pap smear again and see how. And if it is even at the level of the CIN2, it's actually follow the severity, CIN1, 2, and 3. The 3 one is almost there, the risk to develop cervical cancer. CIN1 to progress to the cervical cancer is less than 1%. So means that if we already detect the patient have the CIN1, that means the recovery, the risk for her to develop cervical cancer is very, very less. That's the importance of the screening of the pap smear.
Who can do the screening? What if you have had a family member who has had cervical cancer? Does that put you at a higher risk of getting cervical cancer, or it's not like breast cancer?
Family history is unlikely. But yes, there is whatever related to the hereditary, something like that.
Yeah.
But it's actually for screening, it doesn't mean that you have family baru you nak buat screening lah actually. It's really kita kena, that's why we promote everyone to go for screening, especially who are sexually active. Already sexually active, then you need to be screened.
Especially,
so that means everyone.
Teenagers, would you encourage teenagers to go for cervical cancer screenings? If they are not, if they are, then they should. But if they are not, but they have already come of age.
But if they are sexually active, yes, if they are sexually active, of course we promote. But for the age young, this one 9 to 14, that's why we give another prevention, which is the vaccination.
I see.
The earliest one, 9 to 14, whereby they do not start having sexual any yet. So vaccination, that's the role of the vaccination. For us, I mean, already women who are already married and so on, of course, vaccination also applicable, but the screening is the one of the most important thing.
Okay. Which one would you advise, doctor? Personally, I mean, in your experience, would you say that someone should go for health screenings ataupun you just go for the vaccination? From your personal and professional point of view, screening atau vaccination?
They actually work together. Okay, means that if you already have you already sexual contact, okay, that means you screen yourself, okay, to have to know is there any changes. At the same time, while you are waiting, let's say there is no changes at all, but you need
Yeah.
something to prevent yourself from get infection. Okay, maybe future. Okay, as we know that
Yeah.
the development is quite far, so 10 to
Right.
20 years. Okay, not all the screening. Okay, of course we have a few types of the screening. Okay, the pap smear biasa ataupun we call it the liquid based cytology. Okay, it's not like 100% very assured. Okay, that's why we have to do the vaccination as well. So I mean, at least we assure yourself that kind of the infection can protect you from the common HPV infection later on.
I see.
Okay.
Okay, so that's how cervical cancer develops. And types of
So
HPV. Oh, ni yang banyak ni.
yes, okay. So as you can see from the chart, okay, there is the HPV, about 40 HPV actually related to genital and sex organ. Okay, so the commonest one, that's one is 16, 18, 31, 33, 45, 52, 58, which can cause 90% of the cervical cancer. Okay, or as you can see, 90% of the anal cancer, 90% of the vulvar cancer, and 85% of the vaginal cancer. Mostly actually, this is the high risk one, which can cause cancer in the female. Anal cancer is mainly likely for the male. Okay, for the male anal cancer. So as you can see, it can also affect anal male sex. Okay, because 90% it can cause anal cancer.
You rarely hear that. Is that very rare?
Yeah.
I know we're talking about cervical cancer, but
Okay.
mention that.
Yeah,
Not heard
I'm
of
not very sure of the the statistic of the anal cancer, but I think
Yeah.
which the cause is significant enough, 90%, 90% of
Okay.
the anal cancer.
Right.
Okay. Then the
Okay.
other one is the 6 and 11 also cause genital warts. Okay, what we call ini dalam PM cakap what we call ketuat, something like that lah. Ketuat, ketuat dekat genital area lah. Genital area.
Yeah. Like a pimple, kan? Isn't it like a
Um,
pimple?
something like that, but it more angry looking pimples.
More angry looking.
More angry looking
Angry
pimples.
pimple.
Angry looking pimples. Okay, not like macam very smooth on the surface like that.
Aggressive lah.
Yes. Okay. So
Okay.
So again, as you can see, this is the statistic HPV infection. Okay, as you can see, most of the time, okay, it can cause the genital warts. The million of the cases is called genital warts. Maybe it's a benign or malignant, but most of the time, HPV infection cause the genital wart. So it's actually, as you can see, cervical cancer. The commonest cancer it causes the cervical, anal, vulva, and vaginal.
Okay. Let's take a look at what's
So,
next.
okay, this is the one that Puan Sakina asked me just now. Okay, what are the prevention? Okay, what are the what we can do, okay, to prevent us from the HPV infection? Okay, primary. Okay, this one that we can do is the first one. Okay, the secondary one, of course, for the pap smear. Okay, the primary one, as you can, is the vaccination. That means we detect early age, okay, 9 to 14 years old. We vaccinate them. Okay, so once they are sexually active, okay, so even after the vaccination, we can screen them. Okay, we can screen them by doing pap smear. Okay, the timetable for the screening, as I mentioned before, is first once you are 6 months after you sexually active, you can screen already. So that is considered as the first screen. So if it is normal, you repeat another one, which is next year. So that's considered the second one. So if both are normals, then you need to do it 3 yearly. 3 yearly until the age of the 65. That is the Malaysian recommendation for the screening for the pap smear. Also available
when we're talking about health screenings for cervical cancer, basically that is pap smear lah.
Yes, pap smear. But as we know, pap smear, there are two types, you know, there are the two types, okay? The one that we, the conventional one, the conventional, we call it is the pap smear. The other one, what we call is the liquid-based cytology. Okay, liquid-based cytology, but both are pap smear. Both are pap smear. It's only conventional and the liquid-based. What the advantage of the liquid-based cytology? The cell is more clearer to see. Okay, from the.
But the procedure is the same for both.
The procedure is same. Procedure is the same, but of course, the price also different lah. I mean, the price also different because the methods of the reading also different.
Right, I see. But it's just the other one yang liquid yang doctor mentioned tadi tu, that one is more specific.
Specific and sensitive.
Okay. So if you really want to know, then that's the kind of procedure that you want to go for lah.
Yes, yes. But usually in the government, that what they offer is the conventional one.
Yeah.
Conventional one. Okay. So as I mentioned, okay.
Sorry,
I think this is the there is actually repetition from the previous one. What are the vaccination? What are the diseases that can be prevented by giving the HPV vaccination? Of course, vulva CA, you know, again, vagina CA, anal CA, and as you can see, the yellow one is actually the previous type of the vaccine. The green one is the latest one. Okay, the latest one, which is the Gardasil 9, which covered the 9.
Green one?
The green, I think.
It looks blue actually on my screen.
Okay, sorry. This is the one.
Okay,
maybe blue.
I feel colorblind in this at the moment. Okay, so it's blue. Okay, all right. Yeah.
So the yellow one shows the previous kind of the vaccine, which cover only 4 subtypes of the HPV. And the latest one was the blue or the green one. So it can say that, as we can see, that the coverage is more after we add with the 9 HPV types of the vaccine. It covers more, and the coverage also, of course, more than that. The efficacy also more. Okay.
That's good. Oh, that's it.
Okay.
Okay, good. At least we have covered all the basics, and then now we also have heard from Dr. Salmi about the latest method in order for you to avoid getting cervical cancer, which is the vaccination, the one that is available now at Columbia Asia Hospital, Iskandar Puteri. Okay, doctor, we've got some questions for you. Okay, our first question for today is from Nur Shazliana. Hi, doctor. For those who already got their vaccine, it's compulsory to do screening. Is it compulsory to do screening? If yes, how many times per year do you need to do screening? Thanks in advance.
Okay. Thank you, Shazliana. Okay. Actually, yes, you still need to do screening. Okay, I still need to do screening because to know that because screening is basically we swab from the tissue in the cervix. So yes, as I mentioned in my previous slide, the primary prevention is vaccine. The secondary is the screening. Right. So we need to do both. Okay, after you got the vaccine, after you jab, so of course still you need to do the screening. That's why I said the vaccine itself not assure you 100% that you are protected from the cervical CA, genital CA, vulva or something else, but still need to do the what we call screening as a procedure.
Okay, hope that answers your question, Ms. Nur Shazliana. Okay, our next question comes from Ms. Maya Miswan. Hi, doctor. As you said before, males are also advised to take the vaccination. Is it the same brand like women? I guess the vaccine is the same. It's like 2-in-1 lah.
It's actually the same one, which is the only one I think in Malaysia, the only one I know is Gardasil 9. Okay, Gardasil 9, which is sold by the MSD. Okay, one of which is available in Malaysia lah. So that is the latest one, Gardasil 9, which covered all the 9 vaccines. The 9 subtypes of the HPV. So male and female are same vaccine. It's just the timing may be different. Okay, for the male, maybe 9 to 14 in the early age, you only need to have 2 jab. Compared after at the age of the sexually active, you need 3 jab. Yes, so that kind of the things.
Okay, this is good news lah, because usually when we talk about cervical cancer, it's just on the women to get the vaccines. But now even among males, as young as 9 years old, you should also get yourself vaccinated. So okay, that's fair. All right, from Mr. Chan Lee Hong. Hi, doctor. If I were tested positive for HPV DNA test, should I still need to go for HPV vaccination?
Okay. For Madam Chan, okay. So if you have tested for the HPV DNA, okay, actually if you tested positive, there must be what kind of the HPV they are positive, what kind of the virus, which subtypes. Okay, as we know that maybe usually what the test will come about is like if we test for the HPV DNA positive, they will come out listed which the HPV subtypes you are positive, whether it's a high risk or low risk one. Okay, but if you are if there is not included the high risk one, such as I mentioned previously, 16, 11, 18 and so on, so it's still you still have to need the vaccine, okay, to protect yourself from that kind of the high risk subgroup of the HPV.
I see. Doctor, you mentioned the HPV test, but this one, the question that came from Mr. Chan Lee Hong, he mentions HPV DNA.
Yeah, it's actually there's a specific test for that, Puan Sakina. So that means if we do the liquid based cytology, okay, there is a test that we can
do. The
do
one that you mentioned just now.
Yes, the one that we can detect send together to detect for the HPV. So it's a different one from the conventional one. That's why the price is pricey a little bit compared to the normal.
Because that one they like the part,
Yes, and then it will tell you whether you are infected by the HPV or not.
Is this new, this technology? HPV DNA?
It's actually quite long time already, but it's not like macam usually we do in the government setting because it's quite it's quite pricey. The one that we do usually, the screening one, is the conventional type.
Yeah, so it's available at Columbia Asia Hospital, Iskandar Puteri. Both types of
yes, both types are available.
Okay, all right. So now let's take a look at a question by Miss Alice Demi. Hi, Dr. Salmi. Thank you for your personal and professional knowledge sharing or comments. Ni banyak ni komen saya cakap, hi Dr. Salmi, Fakri Hamzah, Norwana, Indilai. I suppose that's all. Hospital, so in awe of you and your knowledge. Okay, if there are no more questions, then we'll have to wrap up today's session. And Dr. Life would like to thank Dr. Salmi Daraup from Columbia Asia Hospital, Iskandar Puteri. She is the consultant, gynecologist and obstetrician there. Hopefully maybe we can meet again and we can talk about some of the gynecology oncological.
Before I end, maybe I can promote one of the hospital package. Okay? So this is our latest hospital package for the HPV vaccination, which is available in our hospital Iskandar Puteri. It means that the 3 jabs, 3 jabs of the Gardasil 9 vaccine, it costs about 1530. Okay, 1530 with this package, which is only available.
But 3 jabs only for those who are after 14 years old. But if you are between 9 and 14, you only need 2 jabs.
Yes, correct.
Okay. But the package is for 3 jabs terus.
Yeah, this one is for 3 jabs.
Okay. All right. I see. Okay. So that can cover everybody lah.
Yes,
plus side.
Okay.
If you'd like to know more about this new vaccine, you can take a look at our social media. It will be on our Facebook page and also Instagram. Kan betul tak, Doktor? The information nanti kan? The details, okay. All right. So, that's all the time that we have today. Thank you again, Dr. Salmi.
Okay, sama-sama. Okay. Thank you very much for inviting me.
Bye. Assalamualaikum. Have a good evening.